everyone. My name's Howard Catton. I'm a nurse and I'm the CEO of the International Council of Nurses. I'm sure you're aware that ICN is the internationally recognised body that speaks on behalf of nurses. We have a special relationship with the World Health Organization, which allows us to intervene in policy making and ensure that nursing perspective is brought to a whole range of global health work. And our members are national nursing associations. We have more than 130 national nursing associations from right around the world that are in membership. For many years, ICN has taken the lead to set the theme and produce a report and resources for International Nurses Day on the 12th of May. And if you look what we've done over the last few years, you can see that we're very deliberately focused on the big global health challenges that we're facing, the achievement of the Sustainable Development Goals, increasing access to care, achieving universal health care coverage. And we've tried to demonstrate through evidence, research, through case studies, the connection between nurses and nursing and those big global health challenges, quite simply to show that we cannot deliver on the ambitions the world has for improved health for everybody without the work of nurses. And this year, again, our report is entitled Nurses: A Voice to Lead, but we are setting out a very particular vision for future healthcare. And that's going to be informed by the response that we have seen nurses make to the coronavirus pandemic. If you look on our website, you can see that we've been running a commentary and report for over a year now about the work of nurses in response to the pandemic. We've been extremely concerned from the get-go about the high incidence of infections and tragically also deaths of nurses as a result of contracting the virus. The number of infections of healthcare workers, we believe, runs into the millions, and our most recent figure, tragically, more than 3,000 nurses have died that we're aware of, but that's in about 60 countries. I've no doubt that the true figure runs higher. And a reason for that is clearly been a lack of PPE or inadequate PPE. We need to have been doing much, much more to protect our nurses. We actually don't have good standardized and systematic data from around the world, and that's something that ICN has been calling out as well. We've also put reports out on the mental health impacts. In January of this year, the evidence led us to say that we believe that globally nurses were experiencing a mass traumatization as a result of the mental health and psychological impacts they were facing. The last few weeks, we've put out another report to show how that impact is now translating into higher quit and leaver rates amongst nurses. And we've also had a report out in relation to global shortage of nurses generally. We know from the State of the World's Nursing Report that we went into this pandemic 6 million nurses short. Add in the nurses who were planning to retire over the next few years, that takes us to a figure of about 10 million. And if this COVID effect on nursing that I've described results in more nurses leaving, we could be up to 12 or 13 million nurses that we need to replace over the next few years, a staggering figure, approximately close to half of the global population. But we've also set out some of the big health systems weaknesses and failures that we've seen as a result of the pandemic, the lack of preparedness, the nationalism versus the need for global solidarity and multilateralism, the lack of focus on prevention and public health. And a major theme that's run right the way through this pandemic that's been exposed almost laser-like are the inequalities that exists in our societies and our health systems. Lack of attention on mental health and chronic underfunding, care home residents and their greater exposure and risk for the coronavirus, often underlying a lack of investment in social care settings, disproportionate impact on Black, Asian, minority ethnic groups as well. And right now, the inequity in the rollout of the vaccine program. It started overwhelmingly in higher income countries. WHO set a challenge that in the next few days they want to rescind the vaccine rollout program in all countries. Of course, we support that and the importance of prioritizing nurses and healthcare workers everywhere, not just for their health and well-being and because they have rights to be protected at work, but because we know that without nurses, without health workers, we have no health systems. And this isn't just about responding to the pandemic, but all of those other health needs that we know people have been experiencing, but also the growth in waiting times, the backlog of other healthcare needs that there are, which need to be addressed. And that's why we're taking this International Nurses Day as the opportunity not only to set out in the way that I have the nursing response to the pandemic, but to use it as a pivot point to look to the future, the types of health systems that we want to see, and the central leadership role in both the design of health systems, but also delivery that we think nurses are absolutely fundamental to. If we want to have prevention, public health focused services that are people-centered, integrated, are sustainable, are dealing with an aging population, non-communicable diseases, as well as the disasters that we see around the world. Again, this is the work of nurses. A couple of really critical things important to deliver on that. Leadership I've already talked about. We need to do much, much more to see chief nursing officers and senior leading nursing voices at top tables in health systems and at political level in all countries around the world. We think there is massive untapped potential for advanced nursing practice to lead health systems, new models of care. Indeed, we're starting to see in some countries a recognition of the solution that is advanced practice to the growing health needs that we are seeing. But of course, what underlies all of this is the importance of investment. Investment in our health workforce, in education, in decent work, in career development, in leadership positions. This is going to be a challenge as the world faces the economic consequences of the pandemic. We need to continue to argue for a change in mindset, to see investment in health, spending on health exactly as an investment, not as a cost. So there's a taste of some of the key issues that will be in this year's International Nurses Day, the work of ICN, but also our vision for future health systems and the role of nurses. Please let me wish you all a very happy International Nurses Day. Thank you and take care.